For me, is everyone there? The meeting is okay. Noah, Gabe, Mira, can you hear me? Cody? Okay, there you go. All right, good. We're going to do our surveillance report. Lauren is on. We couldn't access anybody from MSU, although things are going well there. And then we'll throw it open to questions. This could be a pretty short call today. Hang in there with me. Can you all see that surveillance report? Okay. So this is the surveillance report heading into Memorial Day weekend. It continues. You know, we've seen we have a rolling 7-day average is at a little over 7 cases per 100,000. That is a slight increase, but not anything that it's really. I would regard this as being pretty consistent with what we were seeing last year or last week. Our case numbers are below 10 cases per day per 100,000. That's where we want them, and I would expect if we can keep them down in that area in the medium to long term, I don't think there's any chance we're going to ever see, or we're going to see in the near future, 0 cases. We're just going to continue to see, and you've seen that in other counties in Montana. We're really in line or below where a lot of other counties in Montana are right now. And I expect that'll continue for some time to come. It's worth continuing to monitor. It could still go up. We're not through this. It's important, especially that people continue to get vaccines. You can see our positivity rate is down to about 5.3%. That's a little bit lower than where we were. This changes. Keep in mind these numbers change as new test results come in. So this number from last week might look a little bit different than you remember, but that's because we get a fuller set of data to base it on. The bottom line though is at 5%, at roughly 5%. You know, we'd like to be below that, but that's pretty good compared to where we were. And it's an indication that we have enough testing going on in the community to find the cases that are out there. Getting test results back pretty quick. There are some days where it takes a couple days, but generally speaking, our median time from specimen collection to report to public health was 1 day. And you can see we're getting to those cases with a lower number of cases. We're able to get those investigations started. That's the onset date. You can see we're seeing fewer cases, so we're seeing fewer people reporting symptoms of the disease, diagnosed cases, and then you can see our age breakdown there. MSU, we probably are going to discontinue having this comparison because it really comparing it to when school in session doesn't mean a heck of a lot. We're really not seeing. We didn't have any new cases reported coming out of MSU over the last week, and we're still dealing with just 2 cases there. Still seeing cases in schools, still working with some long-term care facilities where we've got staff that have either who are in quarantine because they've been exposed. And the hospital, we don't have the hospital figure today. We didn't get it, but I'll tell you, looking at the census report, it doesn't look a heck of a lot different than what we've been seeing the last couple of weeks. I think this morning we had fewer than like a single digit numbers in the hospital and I think only 1 in critical care. So that's good. What I would say is I think the progress that we've been making is related to vaccine. I mean, the vaccine is a really powerful tool to slow down transmission. I would say that it's really important that we keep getting people vaccinated, and that's going to become an increasing challenge as we move forward and we get to those people who haven't taken the opportunity to do it yet. Getting back to normal really is about people continuing to take the vaccine, and to the extent that we can continue to give shots and continue to get our vaccine rates up, that'll be important. I don't know if those of you who were on the call on the Board of Health meeting yesterday, what we are seeing in our vaccine rates This is Gallatin County as of 5/21, and this is first dose. And we're seeing really good uptake in those upper age groups and areas of real opportunity in those younger age brackets. And once we get a little bit deeper penetration into like some of these younger age categories to be able to get a higher coverage, I think that'll bring our overall. We've got 58% of our current eligible population has received at least a first dose. Those numbers, of course, come down a little bit when you're talking about fully vaccinated, just because it takes time to get people fully vaccinated. And when you look at Gallatin County compared to other counties in the state, we're now above the state average in terms of percent of eligible Montanans 12 and older who are fully vaccinated. But I really think there's some opportunity here. We're heading into summer now. It seems hard to think about the end of summer, especially in Montana right now, but it'll be here. In public health, we know it'll be here before we know it. We'll have kids going back to school. We'll have MSU students returning. Being able to get those populations access to vaccines is going to be really important, I think, heading into the fall and influenza season. And we might have younger age groups become eligible, so that continued focus on making the vaccine available to people and people being willing to take the vaccine is going to be super important moving forward. With that, Lauren, I think I heard that you didn't have any. You're welcome to, but I think I heard that you didn't have any prepared comments. But let me know if I'm wrong about that.
Nope, correct. I'm here to answer questions if there are any.
Okay. So with that, we'd open it up for questions. Not all at once.
This may have been something that you covered last week. I wasn't able to make it, but a few weeks ago, you mentioned that the vaccine point of dispensing at the fairgrounds was going to be winding down by the end of the month, and you'd kind of be moving on to more targeted vaccination sites. Would you mind describing what that looks like right now?
Yeah, so the fairgrounds site, I think our last planned clinic at the fairgrounds, we may come back there in the future, especially if we get younger age groups. If there's a need for it, we do have some reservations for those facilities, but our last planned clinic at the fairgrounds, I think, is going to be June 8th. And that'll be a second dose clinic. There is capacity in the community to be able to give these shots. What we're doing is, Gabe, is we're using the same contractors that we've been using at the fairgrounds, and using those contracts to send them out into the community. So I know that we've had events at schools, we've had events at car dealerships, we've had events with employers. And we'll continue to do those sorts of events. We're looking for ways to have drive-through sites, potentially on 191 as people go up toward Big Sky and West Yellowstone. We're just kind of looking for wherever we can find places where we can get significant numbers of people who want the vaccine. We're really eager to be able to provide that access. So that's through contracts that we have with a provider here in town called Best Practices Medicine. We're also using AMR, the ambulance provider, to help with some of the work that we're doing at the fairgrounds. We'll continue to do that. And then as we plan and as we build our plans for influenza clinics and back to school clinics, I am sure that I won't be here by then, but I'm sure that the COVID vaccine will be featured prominently in that for people who want the vaccine. Again, this is all tailored to people who want to get vaccinated. Whitney, do you have anything to add to that regarding the outreach in the community? I'm probably missing something there, but.
No, I think you hit it. I wish I could remember all the places. We do have a number of places on the docket, like businesses that are interested in having clinics that Keith mentioned on the Board of Health meeting yesterday, and I don't recall anymore. But yeah, we've had one at Wrestler. We're going to have one at a way station in Four Corners that had to be postponed. That's still. in
I
the
don't
works.
think it's going to be at the way station. We're looking at an alternate site there, but
Okay, yeah.
we're
So
looking for we're just trying to make it so convenient that it's hard for people to use convenience as a reason not to get vaccinated. And I know the other thing to keep in mind that we're not the only show in town. We've got pharmacies that are giving vaccines. Bozeman Health is still working hard to give vaccines to its patients and even people who are not their patients. So that work continues. And the other thing that's happening is we're using our website and we're using some of our grant funding to raise awareness of this through both paid advertising and earned advertising like we're doing right now.
And as with the, we've been doing with all of our clinics, those clinics that Best Practice Medicine put on, or it will put on, will also be listed on our website as well. So that's still going to be a resource for the community to find clinics in the future.
Gabe, I think it's worth noting for you, MSU is also incentivizing anybody from the University of the Montana University system. So you don't have to be a MSU student. I think that you can get like up to $20 in gift cards from Town Pump by getting vaccinated over there. So I think that's something that they're trying to spread the word to your readership about that as well.
Thank you.
You're welcome. Other questions? All right, as a quick one, I think everyone's looking forward to the long weekend. Please have a safe holiday weekend. I really appreciate you being on the call, and we'll keep working hard to keep these numbers down. Thanks.